It's that time of year, cold and flu season. Everyone seems to have the sniffles. What would you like to know about ears, nose, and throat issues? Good evening and welcome to Doctors on Call. I'm Dr. Alan Johns from the Department of Family Medicine and Community Health at the University of Minnesota Medical School, Duluth. I'll be your host tonight. We'll be taking your questions about ENT problems at 218-788-2844 or toll free at 1-877-307-8762. I'm pleased to welcome our panelists who will be answering your questions. Dr. David Choquette, an ENT specialist with Northland Ear and Nose and Throat Associates. Dr. Jake Prunuske, a family physician with the Lake Superior Community Health Center in Superior and faculty member at the medical school. And Dr. Mark Rhodes, an ENT specialist with Essentia Health, Duluth Clinic. Our medical students answering phones tonight are Carl Koivisto of Choquette, Minnesota, Brent Chodel from Sauk Rapids, Minnesota, and Cammie Young, who is from Vernon Center, Minnesota. And now on to tonight's program on ENT problems. Well, Dr. Prunuske, I'll start out with you. Sinus troubles. Seems like everybody has sinus troubles. I mean, when do you get concerned that it's more than just a cold?
Well, sinus troubles are certainly very common, especially as we move into the fall and people start to clump together in enclosed spaces between schools and work. Sinus troubles can be caused by lots of things. Sometimes it's allergies, sometimes it's infections, sometimes it's other things. Colds can last anywhere from a few days to a few weeks. So if people move past 2 to 3 weeks with sinus symptoms, at that point I generally recommend they get seen by their doctor. Certainly beforehand, if their symptoms are severe or seem unbearable, it's reasonable to contact a physician first. But oftentimes, even with a sinus infection, we'll recommend time and symptomatic care and see what happens.
So, Dr. Choquette, when people come in, by the time they get to you with their sinus problems, what other things are we talking about here? Are there other issues going on?
Well, the symptoms they're usually complaining of are either nasal obstruction or excessive drainage or pain in the head around the cheeks, eyes, or forehead, or sometimes their teeth or chronic cough. And they'll have a story that goes along with that is quite bothersome, and they've usually been on some antibiotics by the time they see us. And so if the exam looks like it's consistent with a sinus infection that doesn't want to clear up, if they haven't had a lengthy enough or long enough course of antibiotics, we'll get some of that going. And then if they have, we'll take some pictures of the sinuses and see what's happening. It's really surprising how often people have really extreme sinus complaints, but yet what they have is a congested nose. And the nerves that serve the nasal cavity and the sinuses are one and the same. So if the nose is obstructed, it'll feel like a sinus infection and it'll be very bothersome. And it's hard when you try to explain to someone with normal CTs that they've got no sinusitis, they've got a very bad nose. It's a disappointment for them. They're hoping that I can take my tools and drill some holes and vacuum everything out. But there are people with sinus disease that we take care of that do need surgery. But most of them
maybe
don't.
I could ask Dr. Rhodes, well, what type of surgery are we talking about here? Drilling holes, I hear.
Primarily the surgery we work on now for the sinuses is what we refer to as endoscopic surgery. So it really is an effort to make the openings to the sinus bigger. But also with that, oftentimes we are addressing problems within the nose itself. It'll often be associated with what we call septoplasty, sometimes reduction of the turbinates. Mm-hmm. So, but modern sinus surgery is often very successful, helpful, and not nearly as uncomfortable as people think it's going to be.
Well, that's good news.
It doesn't cure allergies well, and that's a big frustration for our patients, because we'll do surgery and we'll make the openings better, but we don't change the biochemistry of allergy. Mm-hmm. And so those patients are somewhat frustrated unless they can get their allergies under control.
Thank you. Dr. Prunuske, a caller from Grand Marais, would like to know, are there any new treatments for Meniere's disease? Or maybe you could talk about a little bit about Meniere's.
So Meniere's disease is actually challenging to treat. It's condition which can cause people to feel vertigo or sense the room spinning around them. There's a couple different things which can cause vertigo, either problems within our brain or problems with the nerves as they go out to our balance systems. Meniere's disease is just one of several. There are a couple over-the-counter medications actually that can be helpful. There's a medication called meclizine, which sometimes gives people relief. There's also some other treatments. You can buy what are called C-bands, S-E-A as in the ocean, C-bands that put pressure on the insides of the wrist, and for some people help reduce a sensation of nausea, dizziness, and vertigo. Oftentimes for people, it's a matter of time and things will resolve. Sometimes they don't. And with Meniere's disease, it's important you want to make sure you've got the correct diagnosis, because in particular, you could be missing tumors that would be treated differently, or other conditions that could be addressed by physical therapy, for example. So making certain that the diagnosis actually is Meniere's disease is very important before moving forward to treatment. There are some things which are much more severe and cause similar symptoms early on.
Thank you. Dr. Choquette, a caller from Duluth would like to know, are ear infections hereditary?
Well, the infection really isn't, but the propensity or the predilection to them could be. It could be that a person has handed down a anatomical abnormality where the eustachian tube is narrow and small and it plugs up more easily so that the ear becomes more infected. There are some environments that people live in that are more prone to cause infection, and it's not hereditary, but it's more of a social thing where there's dust in the house, or there's some pets people are allergic to, or there's smoking going on, or other things like that that can make it seem like it's hereditary, but it's just because there's air quality issues in a home that can cause the problem.
Thank you. Dr. Rhodes, a caller from Duluth. She has trouble with her ears, she has ringing and some trouble swallowing, acid reflux, and her sinuses are full. She has a headache a lot of times. She asks, should she get a CT? Now, it's hard to give specific advice for one patient, but maybe the question would be, when do you get a CT?
Well, this particular individual kind of has the trifecta of ears, nose, and throat problems. That's for sure. And when we're dealing with multiple different symptoms like that, the first thing I would start with, obviously, is a nice, thorough examination. CTs are very helpful with certain problems. Sinus disease there can be key to our evaluation of that. For ear problems, then we're more thinking about hearing tests. So CTs are good for certain problems, but not good for all problems.
I'd like to follow that up as well. As a primary care doc and not just an ear, nose, and throat specialist, when I hear that combination of symptoms, I often think of heartburn, of gastroesophageal reflux. And gastroesophageal reflux sometimes can cause sinus symptoms, can cause ear symptoms, can cause sore throat, and sometimes it gets overlooked because the patient comes in saying, look, I'm concerned I have this ear problem or this nose problem, and the physician doesn't initially think that it might actually be caused from something else. The other thing I think of that can cause this combination of head and neck and throat symptoms sometimes is migraine headache, and migraine actually, because of its connection to the nervous system, can cause a lot of other symptoms in the head and neck as well. And so again, thinking broadly as a patient, making sure you get the right diagnosis. Imaging certainly has a role in evaluation, but I agree with you. I think a good physical exam and a good history and just getting more of that patient's story and the progression of those symptoms could be really helpful.
Thank you. Dr. Choquette, a caller from Duluth would like to know about current treatments for tinnitus. That's a common one too.
Yeah, I'm really good at curing tinnitus.
I thought so.
No, I'm really not.
Call
Absolutely not. Well, tinnitus is one of the last frontiers of medicine to try to solve, and it's so common and it's so annoying when you're trying to get to sleep.
So it's a ringing
It's
in the
ringing
ears.
in the ears, and we think it has a lot to do with the wear and tear in the inner ear and loss of hair cell function and broken little switches. Your switches are broken, but the nerve that hooks up to your brain is still very much alive, and it sends a phantom noise off to your brain. And if there was a cure, it would be to go in the inner ear and put new hair cells in the cochlea, or alternatively, selectively unplug those nerve fibers that are sending that ringing sound to the brain, but we can't do that. And when you go to the drugstore, you'll see probably half a dozen medications that have been selected for you to work, and really there may be some benefit on some of them for a few people, but usually they don't work. And so it's a matter of understanding what it is and try to mask the noise with other sound in the room. And I cannot cure tinnitus. I wish I could, and everyone else does too.
But I'll often explain to patients, you know, we don't always cure everything. A lot of diseases we manage, you know,
Right.
blood pressure we manage oftentimes. And tinnitus is one of those that often we can manage, as Dr. Choquette was saying, something we refer to as masking, using noise in our environment to help us manage our tinnitus. So I really think people should think more of, again, management. We maybe can't cure it.
Well said. I like that. That's really
good.
good.
Dr. Rhodes, a caller from Rice, Minnesota would like to know about primary immune deficiency disease and sinus infections. Do those two go with each other?
They do go along. It's a fairly rare occurrence, but an individual who does have an immunodeficiency will be more prone to infections in general, and very specifically, your nose tends to be where a lot of stuff makes its way into the body, and so we have a very robust immune system within our nose, and those who doesn't work, it will definitely be more prone to those sinus infections.
Thank you.
Yeah.
Dr. Prunuske, a caller from, I think it's Bovee, I'm not sure. Anyway, would like to know what causes a swollen red ear and what are the treatments? Now, I don't know if she's talking about the external ear or internal ear, but.
I don't know either. If it's the outside of the ear, one of the things I worry about is infection. In particular, patients who have diabetes are a little bit more likely to get a cellulitis or an infection of the skin on the ear itself. Certainly we can see that with trauma. I mean, if you get hit in the ear, you know, wrestlers or boxers or kids roughhousing can end up with trauma to the ear. Sometimes shingles, which is sort of a years after complication of chickenpox, can cause a rash on the ear itself. So there are a number of things which can cause problems with the outside ear. I suppose piercing as well, if people have a piercing infection. If they're talking about the eardrum or the inner ear, more commonly that's caused by bacterial or viral infections, and sometimes by just fluid behind the eardrum.
Okay, thank you. Well, here's a caller who was asking the question I wanted to ask, so I'm glad. From Duluth, is there any usefulness in neti pots? She hates water in her nose as a former swimmer. I know the feeling. I tried using a neti pot one time, and it was just kind of weird.
It's like waterboarding, huh?
It's sort of, yes.
Well, there's great benefit for the application of saline in the nose to help mobilize secretions that are stuck in your nose. And that happens a lot in our indoor desert, especially in the winter time. There's so many people that say their sinuses are awful until they go and visit Florida or go swimming in clean salt water, and they come back and they say they've never been better. And the question is, how can you do that if you don't go to Florida? And so the neti pot was, I think, probably the first thing that was tried. I personally think saline in the nose is great, but I really don't care for the neti pot because I see people with neti ear where they tip their head with the neti pot and the saline ends up drizzling down in their ear, and now they've got an ear full of fluid and they come complaining of that. But there are some cool things to apply saline. There's a bunch of them. There are little atomizers. There's I like the little squirt bottle technique, and it really does help for people that work in taconite mines or in paper mills and stuff where there's a lot of dust in the air. It really helps. It helps people with allergies. You don't want to go crazy with it, but if you're gently irrigating it, that can do wonders to help you breathe better and feel better in your nose.
Thank you.
Just the other condition this time of the year is the nosebleeds. We're starting to enter into nosebleed season, and that derives again from the very dry air we have indoors, and using a little moisturizer in the nose can really help avoid some nosebleeds too.
Okay,
So
I'm
it's
going to
another
ask you a
benefit.
follow-up question
Yes.
about then. How do you stop a nosebleed if I'm at home? Or if I get a nosebleed right now?
Best treatment is pressure, pinch the nose.
Pinch the
So
nose.
you wanna
But
pinch
where
the-
do you pinch the nose? That's the
Okay.
question.
So I'll demonstrate that. So we like to pinch here,
Yeah.
pinch, put pressure, and hold it on.
For how long?
I usually tell people 20 minutes.
20
And
minutes.
I want to echo that. That's, I think, the very important thing is people hold it just really briefly,
Right.
and then they keep checking to see if it's stopped yet. But every time you let go, it starts bleeding again, and you lose what progress you've made towards stopping the bleed. So very important to hold pressure. The other thing, I'll have patients who, a lot of people get these bleeds recurrently. You can actually pack the nose at home without too much risk of harm, and actually take a Kleenex or some toilet paper, roll it up into a little tube, and just pack it on the inside, and it'll hold pressure for you, so you can walk around and do whatever you're doing.
Now, Jake, I'm going to differ with you on that. And the reason is the lining in the nose
Sensitive.
is sensitive. It's almost like the lining in your eyelid. And you're bleeding because that lining is breaking down. And cellulose in the nose, in those sites,
Will dry
is
it up.
irritating. And it just makes it more macerated and irritated. So you're really better off
Pinch the nose.
to pinch the nose and hold it, like Mark says. It's surprising how many textbooks say to squeeze up here.
Right.
And you want to grab it just like you got a skunk under the car, and squeeze it hard, and just sit down and relax and have something to spit some blood that's coming in your mouth. But and if you're in a pickle, if it's bleeding and you
gotta
can't-
run.
and you gotta go somewhere, put something in your nose and it'll help. But it is irritating to the nose to do that.
So are we supposed to sit up while we're doing this?
Yeah.
Not lie down.
The other piece I want to add, for patients who are taking blood thinners, who are anticoagulated, this can be a early sign that your blood thinners aren't adjusted correctly. So if you're a patient who's on blood thinners who has a bloody nose, pinching the nose may not be sufficient, and you may want to give your doctor a call to make sure your blood's not too thin. There are very few times where a bleeding nose is dangerous in the grand scheme of things. That's one of them, and so just keep that in mind as well.
Well, thank you. I don't know where we are with the questions, but
Yeah,
I'll
that's
ask
right.
Dr. Rhodes.
Okay.
There's another common one. What causes itching in the ears?
That's a
Got to
darn
itch your ear.
very good question. And you're not always sure. Most commonly, itching is coming from chronic irritation in the ear. For some individuals, that's because of an underlying skin condition. Things like eczema can cause it. For some people, a lot of the itching is coming because they're itching a lot, meaning using a foreign body in the ear itself is abrading or scratching or irritating the skin and causes more itching. So you're kind of into a cycle now where you've been itching a lot, causing more itching. There can be an underlying infection, sometimes a low-grade infection. And for other individuals, it's an allergy. Certain allergies can cause it.
Thank you. Okay, now we're on common things yet. Dr. Prunuske, wax buildup. What's the best way to remove wax from the ear, and does olive oil work?
Well, so I want to preface this by saying no Q-tips.
There you
Okay,
go.
so
Okay.
I think really commonly our body's actually designed to have wax. This is an important part. It lubricates the ear canal. It helps keep things from damaging the eardrum. We have little tiny hairs that want to move the wax out of our ear, and it falls out in the shower when we're going about life. When you go use Q-tips, you break those hairs off, and then the wax tends to build up. And you take the Q-tip and you jam the wax in against the ear. The Q-tip's probably causing the itching
Exactly.
from damaging the ear canal. Wax buildup by itself is not particularly harmful, bad, or dangerous. It's relatively easy for a physician to remove it if it does become stuck or impacted. For most people, the best thing to do is leave your ears alone. Nothing smaller than your elbow in your ear is.
How about eardrops?
How about
Eardrops, I'm
eardrops?
sorry.
I'd love your opinions.
Yeah,
I
what do you
generally
think?
don't recommend eardrops for my patients. I tell my patients just gently in the shower, let some water run in, not the massage, striking pressure, but just gentle water to flush, and that's sufficient for most.
Eardrops for stuff.
You have an opinion, Dave?
Yeah, some of our patients just don't have the ability to get wax out. They're putting in hearing aids, which plows it in, and it just keeps. It's like a plow at Target, putting the snow in the corner and until it's full. So you have to do something. And the best thing I've come up with, or that I've seen other people do, is for about 3 or 4 days in a row, put hydrogen peroxide in the air, let it really soak, and then the 4th or 5th day mix half lukewarm water, half hydrogen peroxide in a bulb, and get an old butter container or stand in the shower and have someone help you by pulling up on your ear and just very gently lubricate or irrigating, and it'll work its way out. And it usually works, but it requires patience and perseverance.
Yeah, and we do this in the office. My nurses do this in the office pretty frequently for folks who have exactly that problem.
What do you think? Is that okay, or do you have another trick?
And the caller specifically had asked about olive oil.
Yeah.
I mean, for some individuals, olive oil is helpful. For those individuals who maybe do have chronic problems, it can work quite well. The hydrogen peroxide also, though, is most often successful.
Great. A caller from, Dr. Rhodes, a caller from Aurora. She lost her sense of smell and taste. 78 years old. Can a blow to the head cause this?
In fact, yes, it can. It's a pretty, unfortunately, a fairly devastating injury, too. It's no fun to be without your sense of smell, and it can be dangerous. But there are some very, very fine nerve fibers that come from the brain down into the nose, and a blow to the head can cause a shift or a shear of those, and in fact can result in a loss of sense of smell.
Thank you. Dr. Prunuske, a caller from Duluth, wants to know, what do you think of chiropractic manipulation for otitis media in children?
I have to say it's not my area of expertise, so I'm going to defer to either of you if you know more. In general, young kids, 3 months and younger, who have an ear infection should get antibiotics, should be evaluated and seen by their physician. Older kids, age 2 and older, oftentimes will get better on their own whether we treat them or not. And so there's, I'll sometimes manage symptoms, some Tylenol, some reassurance, and close follow-up. They may not even need antibiotics and just resolve. I think there's an age in between with very young kids where it's an individualized decision. As far as chiropractic treatment, if there's a bacterial infection in that older group, those 2 and older who are likely to get better anyway, I don't think it's likely to be harmful. If they were in that younger group or that indeterminate group, I would at least want to be cautious and make sure that we're not missing something that does require a different treatment.
Thank you. Very good. A caller from Grand Rapids wondering about deviated septum and nasal polyps. Forced to breathe through her mouth. Is this something that surgery can help? And even if you have surgery, the polyps just come back?
Yeah, the deviated septum can be repaired. It's a surgery that's relatively simple and relatively fast, and it works. The polypectomy can open your nose for a period of time, but again, it's oftentimes they're allergy mediated, and so you can take out the polyps, but they're going to come up like dandelions. So what we try to do is get the nose as open as it can be, and then have the patient use some topical steroids, which really do work in keeping polyps from coming back, and we encourage them to see an allergist and consider some allergy therapy if they're allergic polyps. It's important because not all masses that look like polyps are polyps. There are other tumors of the nose, so those get evaluated all the time by the pathologist to make sure it is just a benign polyp. And polyps of the nose don't have the same connotation as those that are in the colon. It's not as frightening or scary.
Okay, thank you. Dr. Rhodes, do certain medications cause ringing in the ears?
There are certain medications that do. It's actually relatively uncommon, though. Too high a amount of aspirin will do it, but I want to be cautious that people don't stop taking their aspirin. They have to be on a pretty high dose. But mostly the ringing is caused by these degenerative changes to the nerves of hearing.
Thank you. A caller from Wisconsin, Dr. Prunuske, we're almost done with time here. Do taste buds diminish with age?
I don't know about the processes, whether it's the taste bud or the nervous system or our sensation, but clearly our sense of taste does decline as we age. It actually changes too. Some things actually become stronger, although I think most patients as they age, or most people as they age, find that their sense of taste becomes less. They may find they're spicing their food more, adding more salt, more pepper, and so forth to try to get the flavors out.
Well, thank you very much. That was great. Well, we're out of time. I'd like to thank our panelists, Dr. David Choquette, Dr. Jake Prunuske, and Dr. Mark Rhodes, and our medical students, Carl Koivisto, Brent Chodel, and Cami Young. Please join Dr. Ruth Wester next week for a program on stroke and other neurological problems. Her panelists will be Dr. Demetrius Yannikas, Dr. Samuel Laney, and Dr. Jake Prunuske again. Thank you for watching, and good night.